Lisinopril is one of the most commonly prescribed medicines for high blood pressure, heart failure, and kidney protection in diabetic patients. Millions of people around the world take it every single day. Doctors often describe it as safe, effective, and life-saving. But what many people don't realize is that lisinopril can quietly become dangerous when it is mixed with certain medicines, supplements, or even everyday habits. These interactions usually don't cause instant problems. Instead, they slowly damage your kidneys, dangerously lower your blood pressure, or disrupt the balance of important minerals in your body. That's why many patients feel fine at first and then suddenly experience dizziness, fainting, abnormal heart rhythms, or kidney failure without understanding the real cause. In this video, we will uncover 7 hidden things you should never mix with lisinopril, explained in a simple and clear way, so you can protect your health before serious damage occurs. First, let's quickly understand what lisinopril actually does. Lisinopril belongs to a group of medicines called ACE inhibitors. These medicines relax blood vessels by blocking a chemical that normally tightens them. When blood vessels relax, blood pressure goes down, the heart works with less effort, and the kidneys are protected from pressure damage. That sounds great, but because lisinopril affects blood pressure, kidney blood flow, and potassium levels, anything else that affects these systems can create dangerous interactions. 1. NSAID painkillers. Ibuprofen, naproxen, diclofenac. The first and most dangerous hidden interaction is with common painkillers known as NSAIDs. These include ibuprofen, naproxen, diclofenac, and high-dose aspirin. Many people take these medicines casually for headaches, back pain, joint pain, or fever without thinking twice. The problem is that NSAIDs reduce blood flow to the kidneys, while lisinopril changes pressure inside the kidneys. When taken together, they can silently shut down kidney function. At first, you may feel nothing. Then, you may notice swelling in the legs, reduced urine output, fatigue, or nausea. Blood tests may suddenly show rising creatinine levels, indicating kidney injury. This combination is one of the most common causes of drug-induced kidney failure. Occasional use may be tolerated in some people, but regular or high-dose use is extremely risky, especially in older adults or people with diabetes. 2. Potassium supplements and salt substitutes. The second hidden danger is potassium. Lisinopril naturally increases potassium levels in the blood. This is usually mild, but when combined with potassium supplements, potassium-rich salt substitutes, or certain electrolyte drinks, levels can rise too high. High potassium, also called hyperkalemia, is very dangerous because it affects the heart's electrical system. Symptoms may include muscle weakness, tingling, nausea, slow heartbeat, or sudden cardiac arrest. Many patients don't realize that low-sodium salt substitutes often contain potassium chloride instead of sodium. They think they are making a healthy choice, but in reality, they are increasing a serious risk. Unless your doctor specifically tells you to take potassium, it should generally be avoided while on lisinopril. 3. Other blood pressure medicines, ARBs and aliskiren. The third interaction involves other blood pressure medicines that work on the same hormonal system. Drugs like losartan, valsartan, and candesartan are called ARBs. Another drug called aliskiren works similarly. Combining these with lisinopril used to be common practice, but studies showed that the combination increases the risk of kidney failure, dangerously low blood pressure, and high potassium without providing extra benefit. Patients may experience dizziness, fainting, confusion, or sudden kidney damage. Today, doctors usually avoid this combination unless there is a very specific reason and close monitoring. Taking these medicines together without medical supervision is unsafe. 4. Decongestants and cold medicines. The fourth hidden problem comes from over-the-counter cold and flu medicines. Many decongestants contain pseudoephedrine or phenylephrine. These substances tighten blood vessels to relieve nasal congestion. Unfortunately, they also raise blood pressure and work against lisinopril. This can cause sudden spikes in blood pressure, headaches, heart palpitations, and chest pain. Some patients think lisinopril stopped working, when in reality, the cold medicine is canceling its effects. Always read labels carefully. Even some non-drowsy cold medicines contain hidden decongestants that can interfere with blood pressure control. 5. Lithium, mood stabilizer. The fifth interaction is with lithium, a medicine commonly used to treat bipolar disorder. Lisinopril reduces the kidney's ability to remove lithium from the body. As a result, lithium levels can rise to toxic levels even if the dose hasn't changed. Lithium toxicity can cause tremors, confusion, slurred speech, vomiting, diarrhea, seizures, and in severe cases, coma. This interaction is well documented but still overlooked. Patients taking both medicines require frequent blood tests and close monitoring. Any symptoms of confusion or shaking should never be ignored. 6. Alcohol. The sixth hidden issue is alcohol. While alcohol does not directly block lisinopril, it significantly increases its blood pressure-lowering effect. This can lead to dizziness, lightheadedness, blurred vision, or fainting, especially when standing up quickly. This condition is called orthostatic hypotension. In severe cases, people may fall and injure themselves. Alcohol also stresses the liver and kidneys, increasing overall strain on the body. Occasional small amounts may be tolerated, but regular or heavy drinking greatly increases the risk of side effects. 7. Dehydration and diuretics, water pills. The seventh and often ignored danger is dehydration, especially when combined with diuretics, also known as water pills. Diuretics cause the body to lose fluid and salt. When combined with lisinopril, this can cause blood pressure to drop too low and reduce blood flow to the kidneys. Dehydration from vomiting, diarrhea, excessive sweating, or fasting can have the same effect. Symptoms include extreme weakness, dizziness, fainting, and reduced urine output. Many cases of sudden kidney injury occur during illness when patients continue lisinopril despite being dehydrated. Doctors often advise temporarily stopping lisinopril during severe dehydration or acute illness. What makes these interactions especially dangerous is that they often don't cause immediate pain. Damage builds silently over days or weeks. Many patients only discover the problem when routine blood tests show kidney failure or abnormal potassium levels. That's why awareness is critical. Medicines that are safe alone can become harmful when combined. If you are taking lisinopril, never start a new medicine, supplement, or herbal product without checking with your doctor or pharmacist. Always inform healthcare providers that you are on an ACE inhibitor. Read labels carefully, especially for painkillers and cold medicines. Stay hydrated, monitor blood pressure regularly, and get routine blood tests to check kidney function and potassium levels. Lisinopril is a powerful and beneficial medicine, but only when used wisely. If you found this video helpful, like it, share it, and subscribe for more clear and honest medical explanations. Your health depends on knowledge.